Hi, I'm Dr. Michael Bishop. I'm director of the David and Etta Jonas Center for Cellular Therapy at the University of Chicago, and I'm at 2024 annual meeting of the American Society of Hematology here in San Diego. Yeah, I have the privilege on behalf of my co-investigators to talk about Anito-cel, which is a very unique anti-BCMA CAR T-cell therapy, and it has a unique receptor. Which is different than other anti-BCMA CARs. It's a synthetic receptor instead of being derived from a monoclonal antibody. And I am presenting the long-term results with Anito-cel. What is very unique is that we were very surprised that it has a 100% response rate. And of those 100 responses, 92% are very good partial responses or better, and nearly 80% are complete responders. So this, for right now in a phase 1 study, is incredibly remarkable and looks possibly to be best in class relative to this. Now, in terms of long-term results, for those patients who do respond, the median progression-free survival is 2.5 years. This also appears to be the best results ever reported in terms of progression-free survival. So that's very, very exciting. Then to make things even better, the incidence of cytokine release syndrome and neurologic toxicities are also seen to be very, very good. Now, the incidence of cytokine release syndrome is 95%. However, only one case was grade 3, no grade 4 CRS. In the neurologic toxicities, the incidence is 20%. And only one case of grade 3, no grade 4. So it's a very well-tolerated product with a high degree of efficacy. Multiply relapsed multiple myeloma patients who, again, had to have seen a proteasome inhibitor, had to see an anti-CD38 monoclonal antibody, and had to see an immune-modulating drug. A significant proportion of these patients had undergone prior autologous stem cell transplantation. So these patients had 3 or more lines of prior therapy. We have not seen any incidence of Parkinsonian-like syndrome in any of these patients so far in our current follow-up among this patient population, nor long-term neurologic toxicities. The phase 1 portion of the trial is closed, and now it's just in the long-term follow-up, but there is actually an ongoing phase 2, which is nearing completion, and this will be a registration trial, and hopefully this will we'll have the results of that at next year's app. In this patient population, it was very, very limited because this study was started about 4 or 5 years ago, before other BCMA therapies were available. However, in subgroup of populations of looking at patients with high-risk disease and extramedullary disease, we're actually seeing very good responses. And that's another thing to this. All of the investigators are very, very excited about. When you're doing a phase 1 study, you don't expect these types of results. And it's, well, the first patient went into a complete remission, the second patient went into a complete remission. And so it actually looked at 2 cell dosing, and actually the lower dose had even a better toxicity profile, and yet still same degree of efficacy, and that's what's being investigated in the current phase 2 trial, which we are participating on at the University of Chicago.